Good morning, everyone. Welcome to Health Talk. It is Monday. It's John King over there. Good morning, John. How's it going?
Good. How are you?
Excellent. We have another great guest in studio from Providence Health and Services. That's Dr. Kathy Showers. She's a doctor of physical therapy. How are you?
Good morning. I'm great.
Welcome,
Thank you.
Welcome to the show.
Thank you.
So tell us about Kathy Showers. How did you get involved in physical therapy, aside from wanting to manipulate people's bodies?
Well, that's pretty easy to do. But no, I was actually in your business for quite a while in Boise, Idaho.
And then you got a real job.
I got a real job. Yeah, I did. It made me realize this. Well, actually, you guys, what your job is pretty darn fun. And I produced a radio talk show, just like you, John,
Wow.
and had a blast doing that for a couple of years. And then I thought, I do need to get a real job. Just kidding. No, I went back to school here in 2003, got my doctorate of physical therapy, and I've been practicing at St. Pat's for 7.5 years-ish.
So tell me a little bit about your department. Physical therapy, we have this idea, okay, I fell, I broke my arm, I've got a fracture of my leg, I have to relearn how to use stuff. So tell me what the physical therapist does.
Well, basically, we work on restoring function. So if you've fallen and you've sprained an ankle, we work on movement and balance and strength again, and also pain reduction. So that's kind of the wide spectrum of what we do. But we also treat people who have poor balance, people who have neurological diseases such as Parkinson's disease, what we'll talk about today, but also people who have had amputations, and we work with people learning to walk with their new prosthetics.
Right.
Also with people who have lymphedema after having a type of cancer surgery such as breast cancer, lots of swelling. We have a specialized therapist that works in that field. So we basically work on the wide gamut of people with some of their functional deficits, is what we call it.
So people who are physical therapists, they really have to be totally familiar with every aspect of the way the body functions, right?
Right. The doctorate of physical therapy is a 3-year program, and we learn everything from anatomy to kinetics to drug interactions, because sometimes we're the first person that someone might see after they have a problem. We have to screen them. Are they appropriate for physical therapy, or do they need to see their provider for different testing? And so it's a very specialized field anymore, but
Do you find that people have a tendency in a situation like that to self-diagnose? Say, well, I don't necessarily have to go see the big doctor. I'll go see the physical therapist, and they'll, get me taken care of, and I won't have to actually go into the hospital or anything.
Sure, yeah. The internet is a boon and a bane for self-diagnosing, and sometimes it helps you learn about some things, and maybe you can get some exercises for maybe shoulder pain. But if that pain doesn't go away, it's time to see a specialist.
Right. Right. Now, I had a friend who was injured in an accident where they were falling a tree, and he was supposed to try to, pull it one direction, but it kind of slipped a little bit and yanked his shoulder out of joint.
Oh, ow.
And so he had to go, first of all, get that treated, then he had to go to a physical therapist. And so basically, do you have a program for each kind of injury, or do you tailor it to each specific person?
Right, you tailor it to each specific person. I mean, there are certain exercises that you'd use for, movement. So you want them to move first in good directions without pain. And once they get that movement under control, then we work on strengthening. But we do tailor it according to whatever's going on in that shoulder, because the shoulder is a very
it's very complicated.
It's a very complicated joint. It's not like a finger where you either straighten or bend it. It goes in all different directions. Lots of muscles, tendons, ligaments. You have it can affect the movement. So we have to kind of zero in on what's going on and work on it.
Well, if you don't mind me sharing a personal story, these two hands have had many adventures. This one actually went into a snowblower. And this one was, the wrist was broken in 3 places after when I fell off a ladder, taking my Christmas lights down several years ago. So, first of all, I went to see good old the docs over at Bone and Joint, and I have my own wing over there now.
Named after you.
Yeah, pretty much. And so for each hand, I had to have special exercises with a physical therapist, which I didn't even really realize was going to be part of the regimen. You get it fixed up, you get it operated on, and then you move on. But they said, no, if you want to regain full function of your fingers, and because I'm a drummer and I also play really bad golf, they said you need to to go to see a specialist who can help you get that range of motion back? Because it doesn't just come naturally, right?
Right. You take things for granted as you're a young person, right? And when something is injured, you kind of think, oh, it'll come back. But as we get older,
Right.
things aren't moving as well as they used to. And you have to relearn those movements like a golf swing. It's
Sure.
very technical, as you know.
Right.
And so it takes a lot
Well, for
of
some
work.
people it is anyway.
Well,
It's pretty simple
I
for
think
me.
we all need a little help with our swings.
Yeah.
And so we break down things that you like doing that you had problems with, such as a golf swing. We'll
Right.
get you swinging with the golf club, and we'll watch. And we're not golf pros, but we're movement pros.
Right. And one thing I was really worried about when I broke my wrist, and it was so badly broken that they actually had me up like this for like 4 weeks so
I
that
bet you were
everything
pretty
would set.
stiff.
And when that thing came off, I literally couldn't move it. It was so painful. But the physical therapist she was so kind and so patient, and just bit by bit by bit, I was able to regain that movement. It took a long time.
Yeah, a lot of people are in a hurry. They're impatient. They want to get better, and it does take things a little longer. And so it's good to be patient because it's worth it to take your time.
Now, in a situation like that, do you tell the patient this may take 6 or 8 weeks? This may take longer than you might expect, and just to relax and let things go at the normal pace.
Right. Yeah. A lot of, especially athletes, people who they want to get back on the field
Right.
as quickly as they can. It's not normal for them to take their time and slowly come back to their full functioning. But it sure pays off, because if they go back too soon, they can re-injure it. And it's just we have to reprogram people to think, okay, this is going to take a little while. Please be patient, but do your exercises at home
Right,
as well as
right.
what you're doing in the clinic.
So when we see athletes like Tony Romo, who had a shoulder problem, or somebody else who had a knee problem, and they're going to be on the disabled list for weeks and weeks and weeks, and they're on the sideline. They're just, they just want to get back in the game. But it's important that they don't re-injure themselves the minute they
Right.
go out there.
Yeah. They're disabled much longer when they're in a hurry.
Sure.
Their body's not ready to go back to
Okay.
full sport.
In the show, in the studio right now is Kathy Showers. She's the doctor of physical therapy at Providence Health and Services. Now, when we come back, can you tell us about the big therapy program?
Okay.
We come back. And by the way, if you have a question or a comment, give us a call at 721-1290. We'll be happy to pass that question along to Dr. Kathy Showers here in studio. We'll be right back. Hey, we're back on Health Talk, and our guest is Kathy Showers. She's in the physical therapy department with Providence Health and Services. Now, something that people may not have heard about, it's called the LSVT Big Therapy Program. First of all, it's a kind of a cool acronym. What is LSVT?
Well, it's named after a person, and now I've already forgotten her name because I took the class 2 weeks, so that's horrible.
Okay.
But she had Parkinson's disease,
Okay.
and she had a very difficult time moving. And her speech became very soft and very, you could barely hear her. And she had a very raspy voice.
Mm-hmm.
And some speech therapists, who were working with her, got her to speak very loudly. And as you guys know, that you really need to enunciate
to
and
project,
really know
right.
when, yes, project and kind of be loud.
And that's why we stand during this show,
Right.
because it's better breath support.
Exactly, use your diaphragm a lot, and
Right.
so they so she did very well. Well, they kind of went off on that tangent and found that, well, if she can improve her speech by being loud, how about improve your movement by being big?
Yeah, big, more exaggerated.
Exactly,
Right.
and so they developed this program. The loud part was first, and then they developed this big program. And so it goes hand in hand with speech and physical therapy to work with people with movement disorders brought on by Parkinson's disease. Lee Silverman, thank you. Look at that. Your producer really does his homework. Yes, Lee Silverman. Yes, and so this program has been around for, a couple of decades. It started in Arizona, because there are a lot of senior citizens down there, and they
Sure.
develop Parkinson's disease later in life, usually.
Okay, let's talk about Parkinson's,
Okay.
because I have a dear friend who has Parkinson's. It's just in the very beginning stages.
Yes.
It's very difficult for him. He really is having a hard time dealing with it, but he's a very gracious guy, and so he's doing the best he can. So what exactly is it, and how does it occur, and is there a treatment and cure?
Yeah, well, Parkinson's disease is a neurodegenerative brain disorder that progresses slowly in most people. Most people's symptoms take years to develop, and you can live for years with the disease. And basically, a person's brain slowly stops producing a neurotransmitter called dopamine. With less and less dopamine, a person has less and less ability to regulate their movements, body, emotions, their speech. And so hopefully your friend hasn't progressed quickly, but you start with a kind of a shuffling gait. You might see that. They have a difficult time. Maybe once they stand up, they kind of freeze a little bit. They're moving much slower, and they're moving smaller. And so you see these people, and they look like, it's very sad. Remember Tim Conway in the Carol Burnett show? That's kind of what they look like. They take tiny little steps. Well, when you take tiny little steps, you're not lifting your feet. You can start falling. Your balance gets worse.
Yeah, you start losing the mobility that you had to start with, right?
Exactly. Yeah, and so it, like Michael J. Fox is a prime example of someone that has Parkinson's disease. He's had it for many years. He had it very young, and so the medication that he's taking causes him to just have very writhing type movements. It's from the medication, but he's doing very well. He hasn't really developed any mental type of disorder like dementia. He's very functioning. So the medications have helped him a lot.
Now, is there medication to help, forgive this term, normalize movement or reduce the amount of perhaps shaking or whatever that Parkinson's patients are often come to? I mean, is there a way to get in there and block that and kind of restore some normal function?
Yep, there are some medications that help people manage their problems with walking, movement, tremor. It's basically the levodopa is one of the most common drugs. It's the most commonly prescribed drug. It kind of, mostly with the bradykinesia, so it's the very slow movement, so it kind of improves some of the movement. There's also a surgical intervention called a deep brain stimulator.
Wow.
So they basically implant electrodes into a part of your brain. They're connected to a generator implanted into your chest near your collarbone, and it sends electrical pulses to your brain to help reduce some of the symptoms. So with medication and the deep brain stimulator, plus the movement and the speech therapy, it helps them move much better to live longer lives.
So what happens if someone begins to notice that they have these type of symptoms and they just ignore it? They just hope it'll go away or whatever. I mean, how quickly can that disease progress and have really tragic results?
Well, I'm not really sure. It's not typical for everybody to progress at the same pace.
Right.
Like it can take 10 years. It depends, I think, on your age and maybe your health. I can't really say for sure. 'Cause I'm not a
Everybody's
neurologist.
different.
Everybody's different. But family will probably notice it when they're starting to shuffle a little bit more because your brain isn't processing the stimulus like it used to.
Right.
So you're thinking you're moving just fine. You think you're speaking just fine. But your spouse or your kids or friends might notice that they're a little bit different, and hopefully they're open enough to discuss some of their issues and go talk to a doctor, and then hopefully get a neurologist involved.
So what's the big program? BIG. It's another acronym, I suppose.
I think it's just movement.
Oh,
big
okay, big.
movement.
So, okay, yeah.
And it's just we have to retrain our thought process on treating people into big movements. So we get them to talk big, to stand big, to move their arms big, to take big steps and big long steps.
So to them it might seem over-exaggerated.
It is completely over-exaggerated. That was a big word to say. Sorry. So that they think that they're moving abnormally large, but to us it's like because you're moving large, you're actually moving normally to us.
Right.
So it's a very specific protocol. So
it's very, very subjective to the patient, right?
Yes, and we have to kind of get them to reprogram their thought process on moving. We worked with some people down in Arizona where I took my class, and we tested them on certain movements like getting out of a chair, which is very functioning, right? We timed them before we did some exercises and after the exercises. Their time of getting up and out of a chair improved substantially after about 20 minutes of exercises. And they're just very, very large movements, standing up with big arm movements, stepping and slapping their arms. It's a very interesting program. Seems a little silly at first, but then when you see how well it works, it's just amazing.
Yeah. Well, we're going to take a break and come back. If you have a question, give us a call. Kathy Showers joining us here in studio. She's the doctor of physical therapy at Providence Health and Services. We'll only have her for about another 8 minutes or so give us a call at 721-1290. We'll be right back. Only about 4 minutes or so before we have to let Kathy Showers go here on Health Talk. Now, John, we just got a caller, and what was the question?
Got a call from Susan. She said she knows 3 people that have been diagnosed with Parkinson's, and yet they deny that they have it.
That's tough.
Is that a common thing? Have you noticed that a lot? Or?
Well, sure. I think you're kind of in denial. Maybe that's a horrible thing to hear that you have Parkinson's disease, and a lot of people want to put it off. It's like how many men don't go to the doctor because they don't want to deal with the pain or whatever, right? Or pain in the chest. But those are things that you really need to address, because the sooner you deal with it, the better your outcome will be, and the better your life will be, because you're moving better with the care of a neurologist, medications, things we've been talking about.
Not only that, all these things that happen to our bodies when they begin to don't act normally, that is a signal, if you will,
right,
the way we're made to go get help, right? I mean, these are signals that we're supposed to go someplace and do something now, right?
Right, and we're pretty intelligent. Humans are pretty intelligent. When they notice that things are a little different, they should pay attention. It doesn't mean be a hypochondriac and run to the emergency room every time you've cut your finger or whatever. But it's very important to be honest with yourself and say, wow, this is really bothering me and my wife or my kids or friends, whatever. Maybe I should get this looked at.
Okay. So how do we go about doing that?
All right. Well, the first thing you need to do is have a diagnosis of Parkinson's disease, and there are tests that neurologists do. Doctors, and physical therapists, we notice that people are moving differently. We have an idea that there may be something going on there besides just slow movement. They need to get a diagnosis by their neurologist, get involved with the medical team, including pharmacists, nurses, and then physical therapists. They will refer that person to PT with a very specific treatment of the big program.
Okay, so how do we contact you? And is this something that our insurance will cover, or does it depend on our policy, or what?
You bet. This is a program that's been backed up by enough studies to show its effectiveness, so insurance will pay for it.
Great.
And it's a very intense program. It's 4 days a week for 1 hour each day for 4 weeks. So it's a month of PT coming to the clinic, but you're also to do your home exercises once another hour on the days that you see the therapist, and 2 times when you're not with the therapist. So it's very, very intense. The person needs to make sure that they have the time or the willingness to do this.
And you need a support system, too. I mean, somebody at home to help you.
It helps.
Well, at least remind you, by the way. I mean, not to nag, but have you done your... Yeah.
Well, kind of. It helps.
A nice way of nagging.
In a positive way. Okay, honey, let's do our exercises. We'll do them together.
Right. Okay. We got about a minute and a half left in the program. What do you enjoy most about your job?
Well, you sure get attached to a lot of your patients, and you help them move better when they didn't know that they could do better. Mm-hmm. Especially, we love working with senior citizens because they feel like this is just part of getting old.
Right.
Is moving work.
So why fight it?
Yeah, well, hey, I'm just getting old. It's okay. No, it's not okay. Let's work with you so that you don't fall and break a hip, end up in the hospital, and then that story is that downward spiral.
Right.
So I see a lot of good things coming out with people come in.
Okay, so why your physical therapy program at St. Pat's?
Well, we're part of the medical team, so it's an all-encompassing group, all in one area. We have the neurologists, we have the internists, we have the pharmacists, we have the nursing, we have PT.
We have 30 seconds.
Okay, yeah, so we all work together as one group, and it's more convenient for us to work together.
Okay, how about a phone number?
If you have any questions at St. Pat's Outpatient Physical Therapy, it's 329-5883.
All right. It's been a pleasure. Thank you so much.
Thank you, Peter.
Would you come back again?
Love to.
All right. Thank you. That's Dr. Kathy Showers. She's a doctor of physical therapy at Providence St. Patrick Hospital, and we appreciate her being with us today, talk about physical therapy and the big program. So we'll continue with Talk Back when we come back.